Hi, I'm Ed Highland for HIMSS14 TV. I'm joining you from the massive exhibition hall here at the Orange County Convention Center in Orlando, Florida, where some 37,000 people have turned out for HIMSS' 52nd annual conference and exhibition. Today's focus is education, and HIMSS welcomed early attendees from around the globe who are eager to learn about niche areas of healthcare IT. In a standing room only session, Ed Martinez, CIO of Miami Children's Hospital, shared how their eHealth initiative is transforming the delivery of care to the South Florida community. Attendees learned that by developing innovative mobile applications, patient relationships are improved by giving clinicians immediate, convenient access to EMRs, enriched through unique educational, entertainment, and navigation apps, and empowered by incorporating convenient, accessible information and educational components into all aspects of medical care.
You see a lot of technology being used to extend care away from the hospital, home-based care everywhere, which is the next step. This time in HIMSS, we are looking at technologies that are helping the hospitals achieve this quality in care.
The Centers for Medicare and Medicaid Services held town hall sessions with policy decision makers from the Office of eHealth Standards and Services to discuss initiatives, incentive programs, quality measurement, and showcased 6 components for the transformation of healthcare at the front lines. Those include quality measurement, aligned payment incentives, comparative effectiveness and evidence available, health information technology, quality improvement collaboratives and learning networks, training of clinicians and multidisciplinary teams.
Just hearing the speakers and the experience from all the other institutions across the world, it's great value to be able to bring that back to our own organizations and take those lessons learned and then implement them in our own organization.
I attended a couple today that I really enjoyed. One was on the military health system, Defense Health Agency, on interoperability, and I found it very informative. Since I support the Veterans Administration and we're partnering with them on a lot of things, I found it very useful.
There's definitely quite a variety of material to listen to, and it's been very good for me to hear where some things are going in the future, especially some of these sessions. Most recently, I've just been listening to the ONC preview of their 2015 criteria. It was very, very helpful to see where they're going.
Along with all the education sessions here at HIMSS14, there's of course also official business to conduct. A new year means a new chairman. What does the future hold? Our Carrie Fairnack is standing by now to introduce us to the new chairman. Carrie?
I'm joined now by Paul Kleeberg, incoming chair of HIMSS. We are on the show floor, and Paul, tell us a little bit about what your plans are for the future.
Thank you for asking. You know, my future plans have a lot to do with providing support for those providers who work in rural communities. Urban areas have got good resources, suburban areas have good resources, and I'm concerned that there is a growing digital divide. I want HIMSS to focus some of their energies to make sure that the rural areas have the resources that they need in order to be able to effectively use EHRs and improve the care of the health within their communities.
Tell us a little bit about how HIMSS is preparing providers to get through ICD-10, meaningful use, all of these issues. You
know, one of the benefits of HIMSS and HIMSS membership is there are a lot of volunteers within this organization. And as many well know, we're not really an organization that represents any one particular group. We look at it from all angles. We've got vendor members and we've got provider members. One of our benefits is that our providers work on committees to talk about some of the issues and talk about solutions and provide resources so that those who are out there can use them to help answer some of their questions that they have around ICD-10, meaningful use, and other things. So HIMSS is aware of the challenges and working very hard to make sure that our members and others are well equipped.
Fantastic. Paul, thanks so much for being with us. We appreciate your time. For all of us at HIMSS14 TV, I'm Carrie Fairnack.
Here on day 2 of HIMSS14, the show floor is buzzing with excitement as members take the opportunity to check out the demonstrations, soak up the information, and of course, network with other members.
The actual exhibit hall is absolutely amazing. I'm very impressed with everything this has to offer across EHR, hardware, and everything alike.
The conversation in healthcare changes so quickly from year to year. So this year it's all about ACOs. 2 years ago it was about RTLS, in between meaningful use. But to really see the ebb and flow of the conversation over time is interesting. I mean, you really get a sense of where healthcare has moved over the last 12 months by touching in with HIMSS every year.
It looks amazing, it's huge. huge. Can't wait to pretty much go around and to start meeting all these different companies with different technologies, maybe information I can bring back to my company.
And there's a new activity here in Hall A that's adding some fun to the attendee experience, the HIMSS Wellness Challenge. HIMSS is challenging members to use technology to manage their personal health.
The Wellness Challenge is awesome this year. We're bringing true innovative technology and Misfit Shine as our partner to the Connected Patient Learning Gallery. We, HIMSS, believe that our members, our attendees, really need to walk the talk and get healthy. We are all about innovation and technology. We are about connecting with patients. All of our attendees are patients or consumers within the healthcare system, and we really want them to participate this year. Every day, our members actually can sync up their Misfit device and they can participate. We announce winners every single day at 4:30 p.m. and we're giving wonderful prizes such as certificates for health and wellness, mini iPads using the technology so you could sync up and use the Misfit device.
I saw that online when I signed up that there'd be a wellness challenge, and I've downloaded the application and I've been tracking my steps and calories. I'm very interested in patient-entered data, patient health records, and aggregating all your data. And this really motivated me to do this. It got me like in that group thing going, and so I went out and I did it, and I'm doing it, making it happen.
There is so much going on this week. HIMSS14 TV is excited to be bringing you the coverage. Please, if you're watching this online, share the video with a colleague so they too can keep up to date on the conference experience. For now, I'm Ed Highland, HIMSS14 TV.